Fox 17's Morning Mix. We are celebrating kids. That's what this whole week's going to be about. Today we're talking with Developmental Enhancement and Behavioral Health. That's what we're talking about. It's a big word, big phrase. They're dedicated to helping children reach their full potential.
You know, a child's mind is a beautiful thing, and they offer an array of services to get them help that they need, and they kind of sort it all out sometimes, especially after the year we've had. I think if we look back over the past year as adults, we realize we've had a lot of weight put on our shoulders, but then in the background we notice that we have little ones that are watching us too. They're also dealing with a lot. And so to help everybody sort it all out, Dr. Stephanie Grant, you're one that a lot of people turn to. So thank you so much for being here with us today. So let's go ahead and talk about the name of your business and exactly kind of give us like an overview of what it is that you guys do here.
So our business is called Developmental Enhancement Behavioral Health, and we have offices here in Grand Rapids and then in Granville and Holland. And we provide a variety of mental health services for children of all ages. So we have infant mental health therapists that work with babies, and then through, of course, teenage years up into college, and then, of course, supporting those families as well. So we have mental health services with therapy. We have psychological evaluations that we provide, which would be testing. And then we also have a specialty program called Applied Behavioral Analysis, or ABA, and that's actually one of DE's kind of unique programs. And what that is it's an individualized service for children with autism spectrum disorders to support them and their families. A particular clinician that works with the child, and treatment goals are developed around those child's strengths, as well as maybe some barriers and goals that the family has to work through, whether it's related to communication, social skills, behavioral needs, or maybe even activities of daily living to help those kids best reach their goals.
I love this. So as I said, in the introduction, obviously this past year, we've had to dig really deep into our minds, and the little ones are watching us. So what is it that you'd like to say to parents when it comes to talking to your children about COVID-19, or what is it that we need to understand right about now, what they're going through?
Sure. I think one of the biggest things to understand is that kids are very aware of the changes and the stress. And when the grown-ups try to use language about how we think that, kids, they don't really know, or they're fine, we've kind of kept this from them. When we talk with the kids, that's not actually true. So very few kids are completely protected from this, and so they are very aware. So I would encourage all of the grown-ups to just make sure they continue to have those conversations with kids, to trust that they're not going to make it worse by bringing it up and by talking about those big feelings that might come up with that.
So as a parent, sometimes it's hard to recognize that maybe you need some extra help. When does a parent get to that point? When do you guys like to say, it's okay to reach out to us. We're here for you for a reason?
Right, that's a great question. Well, one of the things I want to encourage listeners is just to know that you don't have to wait till it gets really bad, or to even be really convinced that you need extra help. So you can always schedule an appointment with a clinician to basically check in and to do an intake appointment and say, do we really need extra help? Is this normal? Are we doing the right thing? Because, sometimes I'll have parents that come in and ask those questions, and all I need to say is, you're doing absolutely the right thing. Keep going. Here's when you call me back. But other times, it's very acceptable for parents to recognize either that they need their own support in just doing this parenting thing, because that's been really tricky during COVID in particular. Children have unique differences that maybe that parent just doesn't understand that they need extra help. And so just understanding that, we don't need to have a stigma around this. We're just a part of the team, and that we treat the whole family. And so it can be something that we can put that support in to just really help kind of support everybody in that dyad.
Absolutely. And you talked a little bit about some of the services that you provide here. I think the way you can go about providing those services now has definitely changed with everything that's happened this past year. So if you have parents that maybe are a split household or something like that, and they're a different part of the country, you guys have ways of pulling everybody into a meeting now, don't you?
We do.
Yeah.
So we continue to offer at this point both telehealth as well as in-person visits.
All right. Anything else you'd like to add about the facility, or anybody out there that's really watching right now that's like, I'm on the verge, I think I just need the extra little push to reach out to you guys?
Well, one thing I want to normalize is what kids are going through right now in terms of just their behaviors. And so we're seeing a lot of anxiety and depression symptoms increase. We're definitely hearing all of the adults talk about that increased use of screen time and how kids are using that as a kind of a dissociation and a coping skill, as well as a way to, be in relationship with people they can't be in person with. Even kids that are just kind of more annoying, or kids who are complaining of being bored all of the time, those can all be signs that a child really is starting to struggle with depression or anxiety, and we've seen those increase over this past year.
Anything I can do as a parent once I start noticing some of these things, any simple things I can do, maybe turning off the TV, limiting screen time. And obviously that's a big fight in our house. If we limit the screen time, oh my goodness, that's a big fight. But I understand it's a healthy fight, and it's one, when you choose your battles, that's one maybe you should choose.
Well, I would always encourage parents to recognize their own capacity. So there are going to be moments during this year, and I know that I've had them, where I've been very thankful for that large amount of screen time. And if the parent is in that situation, and that's the difference between a parent feeling like they can do this thing or feeling very overwhelmed, we're going to be thankful for the screen time right now. But just continuing that conversation with kids so that they know that their parents are also having feelings, that this isn't normal, that it's not going to last, and giving permission. I mean, at our house last year, we had an I Hate Coronavirus party where, we jumped on the trampoline and yelled our feelings out loud, and we, shot Nerf guns at a picture of the coronavirus and, did different. We actually made a piñata out of the coronavirus. And just to help my kids understand that, mom and dad are having those feelings too. Like, this is not fun. We don't like this. And so we can get those feelings out in a healthy way. And that I'm okay. I can hold those feelings for you. They're not so big that you have to hold them by yourself.
All right, well, you've provided so much information. I know you have a wealth of knowledge here within this building with lots of great experts. So if people want to reach out to you, what's the best way to go about doing that?
Well, we certainly have a website, so that's debh.org, or we have a phone number of 616-499-2218. So those are all really great ways. And then I would also say that if any clinicians are interested in joining our team, we're always looking for clinicians who are ready to focus on development in children.
All right, well, Dr. Grant and to your staff here, thank you so much for helping the littlest of minds here in West Michigan.
Thanks.
And once again, to learn more about developmental enhancement behavioral health, you can head to their website, DEBH, that's D-E-B as in boy, H.org, or give them a call, 616-499-2218.
Good things they're doing there.
Mm-hmm,
Absolutely love that.